pendulum swings. So in this exercise, you're trying to get a little bit of motion in an injured shoulder. So you don't want to have a heavy weight or have anything extraneous. You're just trying to get motion in the glenohumeral joint. You're going to get supported with a chair, flexing at the hip, having good posture. You're rolling that shoulder back so the scapula sits posterior on the rib cage, pulling that shoulder back. From here, you're allowing the gravity of your hand and your arm just to distract it to some degree, and then you're going to do circles, doing 15 circles going in one direction clockwise, just easy moving it in one way. You shouldn't feel any pain. You're just trying to get some motion in this shoulder joint. And once you're done with that, then you're going to do 15 circles in the opposite direction. Again, you're just trying to get some motion throughout the capsule, stretching it, lubricating it, allowing it to heal gently without pain, but getting some motion into that joint. You want to do this daily, 15 on one direction, 15 on the other.